This in-service is going to be about nursing and the importance of correct medication documentation. Our objective for today will be to review areas of documentation that play an important part of how we take care of our residents, while meeting federal regulations that are mandated to be included in documentation. Some specific areas that we are going to look at today are going to include correct medication ordering techniques, O2 documentation, and medication documentation related to psychotropics and pain medications. A medication order is a written direction that is provided by a prescribing practitioner for a specific medication to be administered to an individual. It is important to remember in the state of Virginia that only physicians, nurse practitioners, dentists, physician assistants, optometrists, and podiatrists can prescribe medications. Nurses cannot prescribe medications, nor can they change medication orders that are already in place. Some of the important things to look at that should be included in a medication order are things such as the date and time, the approved diagnosis. It's important for nurses to pay attention to the medication and make sure that it makes sense for that patient, the right reason. The dose of the medication should always be included, as well as the drug form. For instance, is it a tablet, a liquid, patch? How frequent should this medication be administered, and are there specific times, such as before bed or after meals? Route of administration is always included, as well as the duration of treatment. You will also sometimes see specific considerations or parameters in place, such as pain medication. A couple of things that we can do to minimize the risk of medication errors are to minimize taking verbal orders as much as possible. This is not something that should be a regular form of communication. However, if you are receiving a verbal order, it is important to always repeat it back to the provider to make sure it was understood correctly. Avoid abbreviations whenever possible. We also want to avoid those sort of generic terms such as take or use as needed. Medication orders should include parameters to ensure safety. Also, if you are transcribing orders or taking verbal orders, please remember the appropriate use of decimals and zeros. Effective pain management requires careful and individual titration of analgesics that is based on valid and reliable assessment of pain and pain relief. This is a statement that was created by the American Pain Society in 2013. It is a nurse's responsibility to effectively assess and manage pain. When writing PRN pain medication orders, it's important to remember that range orders enable necessary and safe adjustment in doses based on individual responses to treatment. In order to promote patient safety and reduce medication errors, it is critical that physicians, nurses, and pharmacists share a common understanding of how to properly write, interpret, and carry out PRN range orders. PRN orders for pain medications should include such things as fixed time intervals. For instance, 2 tabs every 6 hours. They should not include dose ranges or time ranges. For example, 1 to 2 tabs every 4 to 6 hours. It is also very important to make sure as the nurse that you are looking for any potential interactions with other prescribed medications. And of course, always make sure that there is an included indication for the medication that is being ordered. Nurses need to evaluate a resident's pain prior to administering pain medication. This is going to include such things as a pain intensity rating, characteristics of the pain, questions such as does it interfere with ADLs. A resident's previous response to pain medications could be applicable. Use of a pain scale that is appropriate for the resident. Sometimes you might have cognitively impaired residents who may not be able to use our traditional 0 to 10 pain scale. You may need to use such things as body language to really assess a resident's pain who may not be able to tell us in the more traditional ways. PRN orders for pain should include parameters, and this can be mild, moderate, severe. For instance, you may see a PRN pain medication order that will say for a pain rating of 1 to 6 or mild to moderate, give Tylenol. For a pain rating of 7 to severe, give a Percocet. And what this allows us to do is to treat mild or moderate pain with non-opioid analgesics when appropriate. It gives the nurse latitude to give medications to give fewer medications or less medications, less strong medications, instead of having a one-size-fits-all sort of approach to pain management. For example, you may see a medication order that says Tylenol 650 milligrams every 4 hours, PRN, mild pain. Pain score 1 to 3. But then you could have an order that says oxycodone 10 milligrams, PO every 4 hours for severe pain. So this just gives us some latitude so that we aren't throwing just one pain medication at the resident's pain. We can give Tylenol, which might be very effective in managing that pain, thus allowing us not to have to give the patient an opioid if it's not applicable. So just some also general reminders about our psychotropic drugs. When residents are on a PRN psychotropic, there's an automatic stop date after 14 days. At this time, the MD must see the resident and reassess the need to continue this psychotropic medication. Examples of things like this are going to be our Seroquels, Ativan, Xanax, those types of medications. It's also important to remember some of our terminology when we are talking about medications. For example, Ativan is not to be ordered for agitation. Okay? This is a medication that should be ordered for anxiety. Haldol is also not to be ordered for agitation. The clinical use for Haldol is for psychosis, hallucinations, delusions, things of that nature. So please keep in mind when you're asking physicians for orders for these things to use your correct terminology. Ativan is to be used for anxiety. Haldol is to be used for things such as psychosis or hallucinations. Now we're going to switch over and talk a little bit about oxygen. It's important to remember that oxygen is a medication. So you must have a physician's order in place in order to initiate or have oxygen therapy for your patient. Oxygen orders must have parameters in place so that we know when to place the resident on oxygen and when to increase or decrease based on our nursing assessment. When oxygen orders are written, they need to specify whether it is PRN or continuous. If it is PRN, there should be parameters in place as to how to direct us in how we treat our residents. These parameters should include the flow rate and what indicators have to be in place to increase the flow rate. For example, this is normally going to be a pulse ox reading. So an appropriate order for oxygen should be something along the lines of oxygen PRN for shortness of breath, 2 liters via nasal cannula if pulse ox is less than 93%. 3 liters if pulse ox is less than 90%, and then call MD for no improvement. This is an example of an appropriate order for oxygen. Please remember that you do need to reevaluate your residents and to titrate your medication as needed. But there needs to be a PRN order in place for this. So just to review a little bit about the process of titration. Titration is the process of determining the medication dose that reduces your symptoms to the greatest possible degree while avoiding as many side effects as possible. When a dose is titrated, adjustments are made as to how much medicine is administered. Remember that oxygen is a medication, so when we are titrating oxygen, we are titrating a medication. So it's important to look at how we would do this. So for instance, we have an order for oxygen 2 to 4 liters to maintain oxygen saturations at 92%. So let's say that our residents' O2 sats are 91% on 2 liters. The nurse increases the O2 up to 2 liters and the sats rise to 95%. The next day, the resident remains on 3 liters of O2, sats are 96%. So at this time, we should be titrating the oxygen back down to see if we can get the resident at a lower level. We should not just assume that because we left the resident at 3 liters that they should stay there for an extended period of time. Okay? We need to titrate our oxygen according to the saturations. Very important to remember, if you are titrating oxygen, you must allow 5 minutes at each dose before further adjustment. Okay? It takes the body approximately 5 minutes to physiologically adapt to this change. It is also important to remember that the sudden withdrawal of oxygen in a patient with hypercapnia leads to rebound hypoxemia. So this is just a little bit of an example of how you would want to titrate your oxygen, as well as how you would want to document. It's very important to make sure that you document your titration process. Now this example is done in 5-minute increments, but your titration could be in 30-minute increments, it could be in an hour. That part, would be specific to your patient, but this is just an example of how you would do this and how you would document it. So at 10 a.m. the sats are 96% on 3 liters. So the O2 is going to get titrated back down to 2.5 liters. So 5 minutes later, I'm going to check my O2 saturation. Resident is still good. The O2 sats are 96%. Our respiratory rate is 12, non-labored. There's no shortness of breath. Pulse is good. So I can titrate my oxygen back down to 2 liters. 5 minutes later, 10:10, sats are 95%. Everything still looks good with our resident. No shortness of breath. Pulse ox is remaining good. Pulse is good. So the oxygen remains at 2 liters. Okay, so at 10:30 I can go back and check again. O2 sats remain at 95%. Vital signs all look good. So at this point our resident can remain on 2 liters of oxygen. So it's very important that if you have increased the oxygen, that you attempt to titrate it back down and that you document this process. Do not just assume I've turned the oxygen up, I can go off and leave it, and it will stay there indefinitely. Always make sure that you are titrating your oxygen back down to the lowest level possible for the resident to achieve the respiratory status that you want. Always make sure that you're rechecking your oxygen saturations, check your vital signs, respiratory assessment, level of consciousness, color, all those important things that are important in a respiratory assessment. A couple of things that we need to keep in mind when it comes to the storage of supplies and equipment that are related to oxygen therapy, CPAP therapy. Oxygen tubing, when oxygen tubing is not in use, it must be in the plastic bag. that is in the resident's room, and this must have the date written on the bag along with the resident's room number. All tubing has to have a date on it, including extension tubing, as well as the humidifier bottles. The tubing and the mask are changed weekly, and normally that is done on Sunday nights. Nebulizer and CPAP equipment are also stored in plastic bags with the proper documentation. It is very important to remember that even if the resident is taking the nasal cannula off for just a few moments, for instance to go to the restroom, the oxygen tubing must still be stored in the plastic bag. It should not be laid on the bedside table or on the resident's bed. Nebulizers are medication, so you must stay in the room with the resident while the treatment is being administered. Do not place the medication in the nebulizer and leave the room for the resident to administer themselves. If a resident does not want the nebulizer treatment when you enter the room, please advise them to notify you when they want the medication. We cannot leave medications unattended in residents' rooms, and nebulizers are medications. Also, please remember to properly store your nebulizer equipment in the plastic bag, which should be properly labeled. So just some important points to remember. PRN medication orders should have parameters. We should have all of those important things in a medication order that make it complete. The resident's name, the drug form, the approved diagnosis, frequency of administration, any type of special parameters, date, time, note, dose, reason, duration of treatment. These are all things that make a complete medication order. We want to minimize verbal orders to decrease the risk of medication errors. We want to avoid abbreviations, once again, to decrease the chances of medication errors. And we want to make sure that we are following those parameters that are going to be set in place for our PRN pain medication orders. PRN psychotropic meds are going to be good for 14 days, and then the MD must reassess and reevaluate the resident and write a new order in order for it to be continued. Ativan is used for anxiety, not agitation. Haldol is used for psychosis and hallucinations, not for agitation. Oxygen is a medication. We must have an order for it. Make sure that you are looking and following the parameters for your oxygen orders. And remember about titration. It is important to titrate the oxygen order back down and to make sure that you are documenting your titration process. O2 and neb tubing is always to be stored in a plastic bag with proper identification. When not in use, change your tubing and your mask once a week, as well as making sure that you are dating your humidification bottles and changing those weekly. That includes our nursing in service for today.